Everybody, I'm Elisa. I'm back. We're going over the female reproductive system, and now we're going to talk a little bit about the female breasts. So the breasts and the mammary glands. So the breast itself is a bit of tissue, mound of tissue that is overlying pectoralis major. It enlarges at puberty and remains so for life, yeah, depending. Um, Most of the time, it contains very little mammary glands. Um, it's primarily fatty adipose tissue as well as supportive. It's interesting because the mammary gland itself is derived from secretive skin glands, right? Evolutionarily speaking. And so it's like these ones we just kind of devoted to secreting specialized like liquid, right? Fatty liquid, which began to become breast milk in mammals. So it develops within the breast during pregnancy. It doesn't really, it remains active in the lactating breast, in the stimulated to be lactating breast. And when an individual is no longer nursing, it atrophies and reduces. Oh, there it is. Okay. There's two main areas of the breast to know about, the body and the axillary tail. So can be the body itself is the largest part of the breast. So it can be very small, um, and many different shapes. There's many different shapes for breasts, conical, I guess, to pendulous, right? So, which can just change with time and weight changes again, and even more time. Also, a lot of that has genetic predisposition, and honestly, also weight and activity. So at the apex is going to be the nipple. So the axillary tail is going to be the part that actually extends out towards the armpit. Would be the part that like rolls out of your shirt or under over your bra. Lymphatics in the axillary tail are like huge. There is so much right here, and they are very important. And it's an important route for breast cancer metastasis. So some people are saying there might be something to antiperspirants, and that it might be worth looking up. Anyway. Right now, we're just going to talk about the breast and the mammary gland. So the nipple itself is surrounded by a circular areola, colored zone, like an areola. The capillaries and nerves are close to the skin and the surface, and they're more sensitive as well. And so there's a couple reasons why it's a little bit darker, and we have the sensitivity. Newborn baby humans can't see a lot, but they can tell darkness and lightness, and so it's thought that it is something that they can be attracted to and possibly focus on when finding the breast. Capillaries and the nerves closest to the skin surface help stimulate the actual lactation process. It has to be stimulated. It has to be stimulated generally by the nipples being um, like contact with the nipples. Sensory nerve fibers in the areola are going to also be able to trigger that letdown, also known as the milk ejection reflex, when an infant nurses. Those areolar glands are kind of like they're between sweat glands and mammary glands themselves. And so what they're doing is they do a good job of protecting the nipple from chapping and cracking during nursing, but it's sometimes not always the best. So there are like lanolins and different types of things that you can buy if you are nursing and you are still experiencing cracking and chapping, because you cannot let that happen, or else the suckling process is going to be inhibited, and there could be infections, and it like kind of like the downstream effects are kind of rough. So, that's very important that they remain free from chapping and cracking during nursing. Smooth muscle fibers in the dermis of the areola are going to actually contract, response to cold, touch, sexual arousal, wrinkling the skin, and making the nipple become more erect. Right, and that would be very useful, right, for lactating, right, for nursing, trying to turn the page. So the non-lactating breast consists mainly of fatty tissue as well as collagen. collagenous tissue, and generally, in a nutshell, most of the breast size is determined by the amount of fatty or adipose tissue there. Also, how much skin has been devoted to that particular area. Suspensory ligaments are going to attach to the breast or the breast to the dermis of the overlaying skin and fascia of the pectoralis major. So it is right adjacent to the muscle. There are ducts that are going to be branching out through the stroma, which is like quite fibrous itself, and it's going to converge on the nipple, kind of making like, like a duct system, right? From where the milk is being produced all the way out to the nipple, so it can reach the infant. Mammary gland, again, we talked about, really starts developing during pregnancy. There it's multilobular, right? So there are many lobes. So between 15 to 20 lobes around the nipple, more or less. Lactiferous duct, meaning is lactating milk duct, is going to drain into each one of the lobes, and it's going to dilate to form the lactiferous sinus, which would then open up into the nipple. So that would be like where the milk ejection reflex kind of comes in. The ducts end in the acini or the sacs, and the acini are surrounded by the myoepithelial cells. So here's kind of what it looks like outside. So this is the fatty tissue supporting it, right? Adipose tissue, suspensory ligaments keeping it into position. The lobes themselves, right, are like rather like kind of large groupings of all of the specific glands. Each one of the lobes is going to be able to kind of like harvest the secreting or the lactated milk out through the duct system. These are the lactiferous ducts. So you can see they kind of move in. So these lactiferous ducts are going to move into this area here, right under the nipple, which is referred to as the lactiferous sinus, right, or cavity. So the milk would be able to store there and be ready for ejection for the ejection reflex. It's also, of course, stored up here in the lobes themselves. Here's the nipple proper. So the areola of the nipple is the outside. The portion with the openings where the milk will be ejected through is the nipple. And the areolar glands are like right at the surface. These like tiny little kind of like everyone thinks they look like pimples, but they're not. They're actual glands, and they are working to secrete to keep that nipple from cracking and drying. But if that does happen, there are, like I said, lanolins and other types of like lotions and moisturizers. It's really important to keep that area healthy, free from cracking, free from dryness and lesion. This is the breast in a cadaver. As you can see, right in here, lots of fatty tissue, lots of adipose. These like white lines are the suspensory ligaments, kind of holding it all together as much as possible. The areola on the outside, as well as the nipple here. Oh, and I should be really specific. This is a non-lactating individual. Here is the breast in a cutaway. This is neat. So this is the secretory acini in a lactating breast. So you can actually kind of see them large, ready, filling up, like able to produce lactate out milk, right, out through the ductal system. Lactating ducts here. Yeah, so those are kind of cool. Pretty cool. All right, so right, they're very cool ducts. All right, so I hope that was helpful. I hope that explains a lot, and I hope you're having a good day. All right, bye-bye.